Hello, I'm Paul Dijkshoek, founder of Elastic Steel, method of athletic conditioning. Today I'm going to talk to you about the turnout of the supporting leg during the sideline kicks. I'm going to focus on side kick, but the three sideline kicks are side kick, roundhouse kick, and hook kick, and their variations. First, we're going to talk about what to look out for when someone cannot turn out the supporting leg, whether it's due to strength, flexibility, or due to body awareness. Okay. So first, let's talk about what to receive when someone cannot turn out the supporting leg during the side kick. 80 or 85% of the time, there's going to be four compensations that you're going to see. Okay. Depending on the age of a person and strength and ability of a person, one of them will come up. Number one, you can see someone throw a side kick without turning out of a supporting leg, okay, like so. And what you're going to see as the kick begins to come up, there's going to be an outward rotation of the kicking leg. So the side kick might start this way, but it's going to extend that way. It's not going to extend completely parallel to the floor. Okay, you're going to see that compensation. You're going to see that hip come up. If the knee is bent, it's going to buckle in. Okay. You're going to have the inner border drop, outer border of the foot lift. You're going to see all that compensation happen. Okay, that's one. Two, if someone cannot rotate, what's going to happen is if they try to rotate, the body's going to follow. So here I'm throwing side kick with my left leg. However, if I cannot rotate my supporting leg, what happens is as the foot begins to rotate, the hip rotates, femur rotates, the body follows it, because I can't have the body in this direction and the leg in this direction if I don't have the strength, flexibility, or awareness for it. So my body's going to follow it, and the kick is going to be behind me. Okay, so the side kick is going to be thrown like this. The person might look over their shoulder to look at their side kick, but it's going to be thrown like that. That's the second compensation. The third and the fourth one are very much related. Okay, someone has parallel feet, they try to throw a kick, the leg doesn't come up any higher, they arch their back severely. Okay, usually people have very flexible lower back. The hyperextended can do that, and then the leg will come up higher. If someone does not have that, they still need to move their pelvis. They're going to actually bend forward and throw the side kick like this. Okay, so number three, arch the back severely. Number four, the hips are still rotated, but the back can be arched, so the body is bent forward. Okay, so those are the four compensations that usually happens. Okay, when we cannot turn out. Sometimes we try to turn out and we can't. Sometimes we don't even do it. Sometimes we lack strength, flexibility, or awareness how to do it. Okay, so now I'm going to show you exercises how to correct that. We're going to work on range of motion. We're going to work on strength of the hip. We're also going to work on the awareness of the body. And this exercise are going to come in two waves. One is preparatory, and you're going to have to do that for at least a few weeks, sometimes even months, depending on your flexibility, strength, balance, and of course your awareness. And then the second stage is going to take you actually closer to a side kick, roundhouse kick, or hook kick with a supporting leg turned out. So the way we're going to do it, first we're going to do the warm-up exercises. Once we're done with the warm-up exercises, on the floor and on the knee, we're going to stand up, do the actual skill exercise, building the awareness. Then we're going to go back down to work a little bit more on the strength and range of motion. Okay? First we're going to lay down on the side. Okay? We're going to bring the knee. You might want to bend your hip a little bit to protect your back, and at the same time for balance, so that your body is balanced a little bit more and not falling forward. Okay? Here we're going to pull the knee in, bring it up, and bring it back. Okay, so we're doing a knee circle on the side here. We're going to do 5 to 10 repetitions, and then we're going to reverse direction. Okay, so we're pulling it up, down, and over. Okay. Same thing on the other side. Pulling it in, up, down, and again do 5 to 10, and then 5 to 10. Okay, some people might do 5 and feel it already. Some people might do 10 and not feel it. That's how you're going to decide. If you did 5 and you're feeling it here already, let it go. And if not, keep going. Okay? So we will do right side, left side, right side, left side. Okay? That's the first form of exercise. We'll do 5 to 10 right, 5 to 10 left, 5 to 10 right, 5 to 10 left. Okay? Okay, now we're going to be on hands and knees. From here, you're going to lift one leg up, extend it back, drop it down, and keep doing that movement, 5 to 10 repetitions, and then the reverse direction. Extend back, rotate out, pull in, and keep doing that movement. Same thing on the other side. The goal is to move just the hip. You don't want the body to shift with the leg. Just the hip by itself. Okay? And once again, we will do right side, left side, right side, left side. Okay, in both directions. And then warm up. Now that we did that, feet are parallel. You stand on one leg. Transfer the weight onto one leg and slowly lift the other leg up. As far as it goes without feeling the pain. Okay? Then we will do the same thing on the other side. Okay? And you might do 5, 5, 5, 5, or 10, 10, 10, 10. Okay, depending. Then we're going to hold. Lift the leg. Notice it doesn't go high. Don't turn it out. And hold. Same thing on the other side. Leg comes up and hold. Okay? Now do not let the knee buckle in, okay? And this happens. You don't want that. This leg is straight, the knee is over the foot, is not inside of the foot, holding this way. Okay? Now that we've done that, we're going to go back to the floor. We're going to repeat the first exercise, but now we're going to do it for a lot more reps. And you would do this about 3 times a week, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, or Sunday. Okay? So here, we're going to continue this exercise. Now we're going to do more repetitions. Once again, you don't want the leg to come up and the whole body to follow. Okay? If anything, lock yourself down, put this arm here, this one here. This will prevent your body from moving, and move just the leg. Okay? So you would do 2 sets in one direction, 2 sets in another. So let's say you're doing 10, you're going to go 10 this way, 10 this way, 10 this way, and 10 this way. Okay? Notice we're doing differently now that it's conditioning, not a warm-up. Okay? Then you'll switch sides, do 10, 10, 10, and 10. Okay? So it looks like this. Okay, now you're going to do this for a while. It might take you a few weeks, it might take you a few months. You want to be able to do 20 repetitions comfortably in each direction. Okay, that's your goal. Without moving anything but your hip. So hip moves, back here. 20 repetitions, good range of motion. This strengthens a little bit, gives range of motion a little bit for the muscles, primarily for the joint. Okay? And here you're going to do the opposite. Okay? You're going to do that. The goal is 20 times in one direction non-stop, 20 times in the other direction with control. Okay? On both sides. Once you can do that pretty easily, you're going to move on. Now we're going to take the second exercise, treat it as conditioning also. Okay? So here you're on hands and knees. Okay? Other side. Okay? Same thing on the other side. Okay? Once again, you don't want the body to move, just the hip. So now, the same thing here, 20 repetitions in each direction. Once you have it, now, and once again, it's going to take you at least a few weeks. Do not rush it. Do this for the appropriate amount of time, so you can test yourself and know that you're ready. Now we're going to move to the second level. So now I'm going to show you the exercise on the floor. We're going to keep the leg extended now, and we're going to use them as a warm-up, and later on you're also going to use them as conditioning. I'm only going to show it to you as a warm-up. However, after you did the warm-up, after you did the staying exercise, you're going to go back to this exercise on the floor and do the same way we did them with a knee bend. Now you're going to do them as a condition exercise. Okay? Also, of course, we're building range of motion. So here, first we use them as a warm-up. You're going to bring straight leg here, up, and down. Okay? Straight leg, up, and down. If you like, you can do the knee exercises a few times to warm up for the straight leg exercise. Okay? Here, up, and down. Okay, this exercise is actually taken from Pilates, and the goal here, once again, is to move only the hip. Hip joint, you don't want to move the pelvis, you don't want to move your spine. Okay? Same thing on the other side. We're here, leg forward, about 90 degrees, straight up and down. And then same thing on the other side. Up, down, and continue the circle. Okay? Now we're going to do the same thing on the knees. So we're here. Notice, first time we're doing it now is a warm-up. Okay? So here the exercise is slightly different. We're going to bring the leg to the side and back. The side and back. We're not doing a circle because we have no room to do the circle. Okay? If I want to do a circle, my foot would have to go into the floor, or my body would have to be lifted. Okay, so my hands and feet would have to be on something. Same thing here. Leg is extended. Coming out to the side and back. You don't want your pelvis to move, you don't want your spine to move, just the hip. Okay? But first we did this exercise as a warm-up. Now the fun begins. Okay? Now you're stable. You can come here and stay here. Now we want to move to a side kick position. It's not going to happen right away, but you know exactly what you're doing and you know exactly where you're going. Okay? So from here, you move with your body being aligned with your leg, and then you come back. Okay? You would only go as far as comfortable. The range of motion is going to build. This exercise is not the main one to build the range of motion. It's more for balance and awareness. The one we did on the floor is more of an exercise for the range of motion. Okay? So here, we move back. Okay? Now, if you're going to find that your leg moves by itself and it's not supposed to, once you have a straight line between your body and the leg, you lock that line. Okay? If the leg moves by itself, then you're going to place your hand behind your leg, okay? And now obviously the leg cannot move by itself because your hand is there. Okay, your arm have locked your body and your leg in a straight line. You move back and back here, okay? 5 to 10 repetitions. Same thing on the other side. Here. So what you're going to notice is, as the leg moves all the way back to a correct position, with a turnout, the kicking leg is actually going to go up. And that's normal. So from here, it moves up and back. Moves up and back. It's actually rather difficult to turn completely and keep that leg that low. Okay, for that reason, when you throw a low side kick, let's say side kick to the knee, you don't need much of a turnout. But as the leg comes up higher, you need a turnout to do it correctly. Okay, so again, here, let's say I'm locking my leg using my arm. First, I'm going to be about here. Okay, and that might take some time while the other exercise also build the range of motion and strength. Okay, and then you begin to turn, the leg is going to come up a little bit higher, and now you have a straight line. Okay, now there are a lot of other issues when working on a correct side kick. We have strong strength and flexibility, lateral and rotational. We have adductors, abductors on kicking leg. We have some flexibility factors of the supporting leg, and we have a lot of other issues. However, here we're only focusing on the supporting leg if someone has an issue with the turnout. So now that you've done the staying exercise, you're going to lie down on your side, do the leg circles. And then you're going to go on your knees and move the leg again. The reason that we don't lie down on the side and then go on the knees and do a lot of repetitions is that we're going to fatigue the muscles that are responsible for control and awareness here, okay, in doing this exercise. And if we fatigue them, we're not going to do this exercise correctly. That's why we only do them a few times as a warm-up, and then we do the staying exercise, which is a very important part of this training, okay? And then after that, we go down on the side again, and we go on the knees again, and we do a lot more repetitions, now working more on the range of motion, more on strengthening. So if at that point you're fatigued, you don't run a chance of getting injured, and at the same time, you're not in a position where fatigue muscles are not allowing you to work on your skills. So these are the exercises to work on the turnout of the supporting leg during the sideline kicks. Give them enough effort, do them diligently, and you're going to have a good turnout, which is going to improve your sideline kicks. Thank you for watching. I can keep spinning. Good today. Outside. We'll go this way. Good.